Thank you so much. Imagine me at 26. I had the perfect life. I was a stay-at-home mom with 2 beautiful little boys, the love of my life. I was married. I lived in Los Angeles. Everything was great, at least on the outside. On the inside, something was missing. Have any of you ever had the desire to change something in your life? Thank you. I had within me a longing to be a doctor, to help people heal. Now, this longing had started when I was just 9 years old. At that time, I was caught doing surgery with bobby pins on my cousin. I got into a lot of trouble for that one, but the longing continued. I worked in my grandfather's medical office. I helped him count out pills. I went on house calls with him. I even helped him deliver a baby. So this longing was there from the age of 9, and it just kept getting louder and louder and louder. At this time, it was like a scream inside of my head. Have any of you ever felt torn by a difficult decision? Thank you. So you know how I felt. You know, on the one hand, I could stay in my perfect life, baking cookies with my boys after school, watching cartoons, setting up play dates, taking them to soccer, all the things I truly loved about being a mom. But I would give up my dream. On the other hand, I could go to medical school, follow my dream. But given the little that I knew about medical school, I knew I'd have to sacrifice so much of my time that I valued spending with my kids. So I was really torn. But at the end of the day, I felt as if, especially looking back, that the decision had already been made for me. And my 9-year-old self knew it. So I went to medical school, and for the past 15 years, I've specialized in treating eating disorders and addictions. You know what? I've been proud of the work I've done. I've been enjoying helping people change their lives. And I think I've done good work. But over the past 5 years, my work in the opiate epidemic, on the front lines of the opiate crisis, have brought me to the brink of despair. How many of you have been hearing about the opiate crisis? Yeah, thank you. Did you know, though, that 50% of Americans have a close friend or family member with an opiate problem? Heroin, prescription drugs, you name it. So that means half of you in this room may know somebody or be close to someone or have someone in your family who's struggling with this life-threatening and devastating disease. Have any of you ever watched someone struggle with a life-threatening disease? Thank you. So you know maybe a little bit of what I've been feeling, seeing patient after patient after patient with this horrible disease. I've worked in treatment centers all over the country. I've been in some of the most popular, the most famous places where celebrities go for their rehab, you know? And what I saw was what has brought me to the brink of despair, and that is people going in, getting help, coming out, they're on a big high. I'm sober, my whole life is different. And we're all happy too, as the staff that helped them. But then they go back home and they relapse again and again and again. Some of them even losing their lives. So this is disturbing because, you know, I didn't go to medical school just to do no harm, as the Hippocratic Oath says. I went to medical school because I truly, from the depth of my being, want to help people heal. So when I see that, that's what has brought me to the brink of despair. So one of the things I noticed is that when I talk about the opiate crisis, it's often hard for people to identify with it. Unless you have someone in your family, you may think, oh, those people are different than me. They're not like me. So would you mind if I painted a little picture by telling you the story of one person with a heroin addiction? How many would like to hear that? Great. Thank you. So his name is Billy, and he was the second of 5 children in a middle-class family. His mom was a teacher. His dad was the head of a nonprofit corporation. And he was a very sensitive boy. You know, and I mention this because many addicts have that same trait. Many people with addictions are very sensitive. So Billy also had, by the way, a reputation for being quite a prankster in his family. He loved to play tricks on his siblings. So Billy did well in school. He was very handsome, loved by all the ladies, by the way. And he ended up going to college. And then at the end of his freshman year, something tragic and unexpected happened to Billy. I didn't mention to you that Billy was very close to his father. As a matter of fact, his father was the anchor in Billy's life. And when he was in college, this tragic event was the sudden and unexpected death of his father, his anchor. Billy's father died, and because he was so sensitive, you know, he was feeling all the feelings of the whole family. And he tried, as the second son, to hold everybody together, to keep the family together. And this was difficult. He was in a tailspin of his own. He was grieving for his dad himself. So Billy started experimenting with drugs, and he quickly found his drug of choice, which was heroin, and he just as quickly became addicted. Billy continued to use heroin for over 30 years. He spent 9 years in a federal penitentiary for drug-related offenses. He almost died because he had kidney failure that was not diagnosed, and that was a result of his untreated high blood pressure and his opiate addiction. But what was interesting was, despite his addiction, he was able to get married, to have 3 children, and to help raise 2 stepsons. Billy was not completely defined by his addiction. And I'll tell you more about his story as we go along. But you may be asking yourself, why did Billy, or why do people like Billy, turn to drugs? Like, what's that about? And I'm not going to ask you to raise your hand, but maybe many of you are thinking, well, Billy, you know, he was just weak. Or maybe it's a moral failing. If he had had a stronger, you know, sense of morality, that wouldn't have happened to him. That's a normal thing to think. And again, we often think that because we don't know people who are like Billy. That's why I wanted to paint that picture. So keep that in mind as we go along. What we know scientifically, I can tell you, is that genetics plays a part in the development of addiction. It's 50 to 60% hereditable. We also know, and the American Society of Addiction Medicine has made this definition, that addictions are a chronic brain disease that affects the dopamine reward center of the brain. Now, I'm sure you've been hearing about the dopamine reward center, and you know that anything that gives us pleasure also can become addictive. It doesn't have to be drugs. So you may be thinking, well, you know, I've never had a drug addiction. I don't even drink. But what about addiction to work? What about that morning cup of coffee that you have to have every day? What about other addictions that we often talk about, like gambling, sex, you name it? Like, how many of you could go for a whole week without your phone or access to social media? Anybody? I rest my case. So, but I want to just go beyond genetics in the brain and tell you that the most important knowledge that we have now that we didn't know about when I started in medicine is that addiction has its roots in trauma. Now let me explain that. Dr. Gabor Mate, addiction psychiatrist from Canada, has defined trauma as the loss of an essential part of yourself. A sense of peace, a sense of safety, a sense of trust or security. When a child under the age of 18 loses a sense of themselves, it changes the brain and it causes pain. So these adverse childhood experiences have been studied by the Centers for Disease Control in a study called the Adverse Childhood Experiences Study that has over 17,000 people in it. And what they found is that there is a direct correlation between childhood trauma and then the later development of addictions, obesity, attention deficit disorder, and 40 other conditions, including medical diseases like heart disease and lung disease. So what that tells us is that when you have had trauma, something changes in the brain. The brain is hijacked. It's hardwired now differently. And when that trauma happens, it causes pain, and the person with addiction uses the drugs or alcohol to numb the pain. So this understanding, if you can just let this in a little bit, addiction has its roots in trauma. This understanding then allows us to shift the conversation from saying about people like Billy, what's wrong with you? Why can't you just get your life together? What's wrong with you? We can shift the conversation to what happened to you and how can we help? Now, I'm not saying that every traumatized person becomes an addict. That would be ridiculous. But I am saying that every person with addiction has been traumatized at some time in their lives and in some way. So why do you think we are failing so badly in getting the opiate epidemic under control? I don't know if you know that every single day, 90 people die from opiate overdose. Every single day. That's just like, imagine a bus filled with 90 people in some city in America, and that bus crashing and those people dying every single day. As a matter of fact, more people died last year from opiate overdoses than died in the entire Vietnam War. So that says to me we're failing because that number isn't changing. And we're not failing for lack of knowledge. I've given you knowledge. I said it's genetics. I said it's a chronic brain disease. We know that addiction has its roots in trauma. But we are not focused on, we're focused on the wrong things. We're not focused on the things that we need to focus on in order to make this change. Because addiction, again, is not about the drug. Think about it. The drug is not the problem. It's the solution to the problem. The problem is the pain from childhood trauma. The drug is the solution. It's the only solution that someone with that hardwiring, with that history of adverse childhood experiences, that's what they have chosen in a way. And I say chosen in quotes because they didn't choose. Their brain was hijacked. And that's what happened. That's what happened to them. So it's so important for us to recognize why we need to shift the conversation, and also to realize that when we don't understand people with addictions, we then stigmatize them. Stigma is our way of saying we don't understand, so there must be something wrong. So stigma is part of the problem. Did people with addiction really choose that fate? How could that be? And it also, stigma causes, it makes it harder for people to get treatment. We know that there are 22 million addicts, 22 million people with addictions, and only 1% of them are getting treatment, 1%. And oftentimes we talk about, send them to treatment, get the 30-day cure. Well, if it's a chronic brain disease, how could 30 days be a cure? So again, we're focusing on the wrong thing. What happens to the 99% of people who don't get treatment? Maybe they go to 12-step meetings and get lucky, and maybe they can quit cold turkey, but for the most part, they're on their own. How would you feel about that if that was your son or daughter? So now for the rest of Billy's story. As I said, Billy had almost died. He ended up having 3 kidney transplants, but about 1.5 years ago, Billy did pass away as a long-term result of his chronic heroin addiction. Billy, at that point, had been married for 42 years. An amazing feat. He had 3 successful grown children, 2 successful grown stepsons, and most importantly to me, Billy was my brother. My baby brother. So as a doctor, I want to tell you, addictions have their roots in trauma. As a sister, I want to tell you that Billy is just like the rest of us. He's like you and me. All he wanted out of his life was to love and to be loved. He taught me so much about addiction. He also taught me so much about love. He was such a big-hearted person. It's hard for me to imagine the planet without him. So, would you be willing to just take a moment with me and imagine a different resolution of the opiate crisis? When Portugal changed what they were focusing on, when they decriminalized drugs, they reduced their overdose deaths by 75%. We could do the same. So what needs to happen? Let's imagine the ability to shift that conversation from what's wrong with you to what happened to you and how can we help. Let's imagine that we could really acknowledge that addiction has its roots in trauma, and therefore, to heal the addiction, we need to treat the trauma. Let's imagine that we can identify with the people that we're surrounded with, that 50% of us know and love, and we can destigmatize addictions. Let's treat this disease like any chronic disease. We don't lock up diabetics when they fail, when they relapse. Why should we lock up someone with a brain disease? So finally, I want to just leave you with this important message. Again, to heal the trauma, to heal the addiction, we must treat the trauma. Thank you.